Influenza is a viral disease that circulates seasonally. Many of you watching this have likely had it at some point in time, and like many people, my family and I all get the influenza vaccine every year in order to decrease the likelihood that we would contract it again. The CDC estimates that we see about 9 to 45 million cases of influenza in the US every year, with about 12,000 to 61,000 deaths. The 1918 through 1919 influenza epidemic infected a third of the world's population and killed somewhere between 20 and 50 million people. So it had a case fatality rate of about 4 to 10%, as compared to the approximately 0.1% case fatality rate for the seasonal flu. As an interesting side note, the 1918 pandemic was also called the Spanish flu, but it didn't actually have anything to do with Spain. Instead, Spain was neutral in the war, so it made a convenient scapegoat to name the epidemic after it. This is one of several reasons why public health professionals in the medical community now push back against the antiquated practice of naming new diseases or pandemics from the site from which they originated. In 1918, the influenza pandemic spread to all continents in waves, and deaths were especially concentrated in poor countries, where malnutrition was common due to the impacts of colonization and could increase the risk of death to people who contracted the disease. In the pandemic, a large portion of the dead were actually previously healthy young adults. This is not the pattern that we typically see for seasonal influenza deaths, where mortality tends to be concentrated among the very young and the very old. In 1918, infants and the elderly were also quite susceptible to influenza, but the biggest spike was actually in adults aged 20 to 40, especially including pregnant women. And importantly, the 1918 pandemic occurred before the invention of influenza vaccines or antibiotics that could be used to treat the bacterial pneumonias that often followed influenza infection. Had those measures been available, we might have seen a far different outcome than we actually did. And notably, US cities that quickly enforced social distancing as a public health intervention, including things like closing schools and banning the congregation of large numbers of people in any one space, had much lower rates of death and infection than cities that did not. In the 1918 influenza pandemic, some patients had relatively common flu symptoms: headache, fever, malaise, cough. But some patients had symptoms that struck violently, from the agonizing pain in their joints that was misdiagnosed as dengue or breakbone fever, to the extreme fever and chills that some patients had that was misdiagnosed as malaria. Some patients had pockets of air just below the skin that leaked through ruptured lungs and made them crackle when rolled onto their sides. During the outbreak, 47% of all deaths in the US were due to influenza. I want for you to sit with that number for a moment. It is staggering to think of an infectious disease epidemic sweeping in and being responsible for nearly half of all deaths in a country during its course. It's also, though, a reminder that even during such an intense and deadly epidemic, people still have cancer and still have injuries and complications of childbirth and a whole host of other pressing health needs that draw from that same scarce pool of resources and medical professionals struggling to staunch the tide of the epidemic. Discussing this topic in March 2020 feels a bit eerie, as we are watching the COVID-19 pandemic spread across the globe and are beginning to feel the very real social and economic impacts in Boston and elsewhere in the United States, despite not having a comparable 1/3 of the world's population infected, as we saw in 1918 and 1919. At least, not yet. And hopefully we won't if our social distancing measures combined with isolation of the sick can be effective. As you consider the lessons learned from the 1918-1919 influenza pandemic, I have a key question that I would like for you to consider. How can societies best prepare for a pandemic disaster like the 1918 influenza pandemic, or indeed like COVID-19? How could hospitals and healthcare workers best be able to handle the surge in demand that the pandemic would spur? And how could societies best prepare for all of the collateral damage that pandemics wreak, in addition to the direct impact of infected cases and deaths?